Assalamualaikum. I'm Dr. Bushra Anwar from PMY Health Canada. As a public health professional and clinical researcher affiliated with McMaster University, I'm dedicated to advancing health knowledge through research and training, including through my startup's online training program at PMY Health. I'm truly honored to be invited to this prestigious second international conference on health professionals, education, and research. It is a privilege for me to speak about knowledge mobilization, which is a dynamic and evolving field over the past 2 decades that is reshaping how research influences policy, practice, and patient outcomes across our health systems. Before I delve into this topic, I would like to briefly share how I was introduced to this field and why it has captured my interest. So, my foundational training in public health took place in Pakistan with an FCPS in community medicine. There, I observed a significant disconnect between research and its practical application. I was very fortunate to lead a research department at a medical college. There, I established an end user unit. It was focused on bridging this gap by facilitating research uptake and collaborations. Although I had to leave this work due to my immigration to Canada, but I was really impressed to find here in Canada that this function is a very well recognized field and supported with formal qualifications. And as I got this opportunity to speak to this distinguished audience, I was eager to choose this topic. Without wasting any further moment, I will start discussing why this is important. So all of us have been involved in writing research papers, and some of the times they are as big as 20 pages or even more. So as big as they are, the more challenging it is for users or public or folks to access and understand it. It is a very well-known fact that science can feel out of reach to many people, making them feel like they don't have the intelligence to understand. However, the main issue is that the scientists are unable to communicate their work in ways that are easy to understand and tailored to a specific audience. We may have even got the chance to communicate our research in conferences, disseminating the findings to larger audiences. But these conferences are also attended by academicians mostly, while practitioners and policymakers do also attend these conferences. But typically, for an academic audience, it does not guarantee that the research will be taken up and implemented. So, how can you plan for dissemination beyond an academic audience? Because it is important to increase the chances of your research to make a difference in policy and practice. So the need of the hour is to understand that right information has to reach the right people in the right format at the right time. This is important to us because the real world application of science is not just affecting advancement in healthcare, but it is affecting our university's ranking, and the funding agencies are also focusing on research impact. There's a term, responsible research assessment, which is gaining attention and popularity. Frameworks are being developed, and recently, frameworks that have been tested and that are gaining popularity include DORA, which is a declaration on research assessment. And on the website, you can read the declaration. It says that institutions should value research based on the influence it has on policy and practice. There are multiple signatories of this declaration, including signatories from Pakistan and Canada, USA. In Pakistan, it was mostly the individual signatories and very few organizations. There's another framework which gives value to research impact in the evaluation of performance of research entities, and that is the research excellence framework. This framework is used to determine how the funds will be allocated to different institutions. So it seems like the research impact is becoming a core component of the research enterprise now. The question is how to manage the research impact. This is where the field of knowledge mobilization and knowledge translation comes in handy. Knowledge mobilization, it consists of a variety of methods in which research and knowledge is transferred, translated, exchanged, and co-produced to enhance the practical application of knowledge between researchers and research users. Knowledge mobilization and knowledge translation, these terms are used interchangeably, but precisely knowledge translation is for typical clinical settings and knowledge mobilization for those that involve more communities, outreach, and social sciences as well. These fields have evolved as responses to the perceived gap between the research production and its use. especially in the healthcare, social sciences, and education. Field relies on co-production models, which moves from research with the academic expertise to the community with that values the non-academic expertise. This framework was adopted by Kids Brain Health Network that guides the network's research to impact processes. And this is how it started gaining more popularity. And it guides how the research developers and the research users co-create it and collaborate throughout this process of research conduct to research dissemination, uptake, and implementation. The underlying values that are important to this field are promoting and encouraging open science, encouraging human-centered approach at all steps, inclusive communication, making the message accessible in terms of clarity of language and extending the reach of the message, and taking care of the cultural norms and sensitivities around the message. So now the question is your organization applying KT and KMB? It may be there in some of your practices, but it may not be formalized as a separate function and not having an exclusive team, but you still may be doing it to some extent. The question is, how much are you practicing it? There is a survey which is designed by University of Ottawa. You can use the survey to assess the levels of KMB in your setup. It's surprising to know that University of Ottawa, when they surveyed, they found that only 40% of the participants in their setup had engaged in KMB activities in the last 1 year, 3 times or more. And the reasons expressed by the faculty for the slow levels of KMB were mainly lack of funding, lack of recognition, lack of time, and lack of incentives. The suggestions made by faculty were to hire exclusive staff, dedicated team to support this KMB as a separate function. And then the university made their institutional knowledge mobilization strategy, which is part of university's strategic plan for 2030. Using these lessons, so how can we set up knowledge mobilization and knowledge function, translation function in our research cells? We need the leadership to, first of all, recognize and understand the value of research application, its use, and to recognize that knowledge mobilization is a separate function that needs special attention and that needs training and time and budget allocation where possible. So starting with training, this is the first step which makes possible the integration of KMB and KT units functions in our research cells. So we have to ensure that our team is well versed with the evidence-based clinical practice and knowing how and what message to take from any research and which message to communicate to which audience. So then they connect with the teams that are trained in media and digital skills and graphic designers, social media experts. And it all depends upon the budgets, but we need multiple skills in our teams to set up the KMB and KT functions. And this is possible by connecting and by connecting different departments in an institution where a research cell can collaborate with the IT department and the marketing teams to build, to plan and build the KT functions. Think of knowledge mobilization activities in the start of the projects when they are being designed. We can apply for funding and it depends upon the needs of the project, how much KT and KMB activities are required. And then we have to embrace collaborations and foster partnerships for the co-creation of knowledge between academia and non-academic stakeholders. Then we utilize the diverse dissemination strategies, combine the traditional publications with social media, infographics, and other engaging formats. And we have to understand the audience uh, and tailor the language and style and content of the message to the needs and preferences of the target audiences. Then comes the robust evaluation for measuring the impact of the KMB and or KT activities and incentivizing impact. The R4R resume is a new format for researchers where they organize information about their contribution to larger society by engaging in different activities such as blog writing, podcasts, other than publications for the advocacy on the subject. So once the team is there, you have trained them in evidence-based policy making and clinical decision and clinical guidelines development. And you have connected them to the content developers, science communicators, media experts, graphic designers. Then you are good to start the knowledge mobilization and knowledge translation function. Let's see how it looks like at a glance. So just focusing on research dissemination here, which is a key step in a research mobilization process. These are the different formats that can be used for knowledge dissemination, and the knowledge mobilization subject guides how and which format can be used, um, when to use which format, which platform to be used. The right engagement strategies will then complement the efforts. So the formats can be, other than the publication, it can be your conference presentation, which many of you are already engaged with. You can write research summaries, a two-page summary, research snapshots, posters, brochures, flyers, community papers, newsletters, policy briefs. You can make a website for your research findings, or you can even write a letter of thanks to the study participants to make them aware of the research findings. So in one line, I would say that it is about doing more with what you know. So not just relying on one publication, but making more and more products out of one project and using all those for the dissemination of the findings and conveying the message to the right audience. Let's see an example from a research. This was for prevention of homelessness in youth, published on through a website, 16-page summary, using infographics, Twitter, Facebook, Instagram, and also podcasts and webinars were done. But with this, remember, it's not just about knowledge dissemination. Knowledge mobilization encompasses activities from the start of research till the end, and it's knowledge synthesis, dissemination, transfer, exchange, and co-creation or co-production by researchers and research users. So how can we take the first step? Just start training. Get your team introduced to this concept. There are trainings, certifications, workshops, and it's a website, Canadian Institutes of Health Research, which has a very comprehensive guide on how to write not these KT plans in your grant. You can see the job descriptions to know more about the roles. And this brings me closer to the end of my talk, and I would reinforce this message again that knowledge mobilization is as important as knowledge generation if we want to make our country a knowledge economy. Globally, this is gaining more attention as the funding agencies start focusing more on impact. Canada is considered as the global leader. UK also has a very significant focus in this subject. Australia follows. US also has KT, but decentralized and lesser. Some developing countries also have started through the efforts of WHO, such as Africa, Uganda, and Kenya. Also visit this Knowledge Mobilization Forum, which is a very comprehensive learning resource. Way forward for us in Pakistan, we need to introduce this subject through courses and incentivize research impact and research and knowledge translation practices in our projects. I'm happy to collaborate if any institution or individuals like to further. My contact details are shared here. Before I end my talk, I would like to share one very favorite quote. The subject that we discussed today, KT and KMB, relies on collaboration. It believes in respecting the role of different segments of society. And it says that innovation rarely results from solitary geniuses having eureka moments. Instead, breakthrough ideas almost always arise from collaborative activity. With this, I end my talk. Thank you very much, and over to the moderators.